Now, have you been keeping your child away from immunisations during this lockdown? Well, the city of Cape Town is concerned about a decline in child immunisations. The city has reported that there's been a 67% drop in the number of immunisations for children in the recent months. The city has reported that children are routinely vaccinated during during these periods against diseases like measles, polio and tuberculosis. Well, joining me to unpack some of the consequences of keeping the children away is the Mayoral Committee Member for Community Services, Zahid Badroodien. Zahid, thanks very much indeed for talking to us. Let me first ask you that a 60% drop in some of these immunisations, that's a huge gap, I mean, against diseases like measles and polio. Exactly how risky is this sort of delay?
It's extremely worrying for us, and obviously goes without saying that there are a number of residents across the city who are very anxious and fearful of going to clinics for a number of different reasons, which obviously includes the unnecessary exposure to COVID-19 and other illnesses that may be contracted at these facilities. And so what we've seen since the lockdown is the tremendous decline, not only in the immunizations which are being administered across our facilities, but also this then connected to the decline in the number of people who are attending our clinics as well. And so it's an important question you ask regarding what are the risks in the future, because whilst at the moment we know about the connections between COVID-19 and comorbidities which patients may have, what we are not accounting for at the moment, which the city is now looking at and actively addressing, is the risks to our patients in the future, and this includes children. And so you mentioned measles, and measles obviously presents in the beginning stages as a very mild condition, but with a number of complications. And so we're engaging at the moment in an active communication drive through a number of teams in the city, community-based teams, environmental health practitioners, other stakeholders that we're working with to encourage our parents and our patients to come back to our clinics, because what the city is in the process of doing at the moment is rolling out what we're calling our overflow decanting facilities. And so we've identified about 80 community halls in the city of Cape Town that are being retrofitted as clinics. There are a number of stages to this project, and the first stages are in the process of being completed. And at the end of this, we would have spent about 70 million rand to retrofit our community halls so that patients and parents and communities can essentially come back to these facilities and access health care. And what we're saying to them is that there no longer needs to be the fear of going to a clinic where you may or may not contract coronavirus or any other diseases, because we're making it safe for our community members to come back to access any number of services. And so this communication drive is underway at the moment, and I was very excited because we started to open up these facilities just last week, and there's a palpable relief in the air when engaging with some of the patients who are now happy to come back to our clinics, especially as it relates to children. And it goes without saying that in the early months of childhood, after a child is born, up to 14 vaccinations need to be administered to these children. And it's so important, because if we miss this opportunity now, we put the children's lives and health at risk later on. And so we're appealing to our residents to come back to our clinics, to come back safely, wearing their masks, where we can help implement social distancing and then the reinitiation of immunizations. But that doesn't even take me to the decline in the number of patients who are not coming to our clinics for TB and HIV care, which is also
and then
part
can
of
I
the
come
process.
in there, if I can, just interject for a moment, Zahid? I mean, because therein lies the problem. Taking one's child to the clinic is undoubtedly a very tough decision for the parent, isn't it? Because of this anxiety, this fear of contracting COVID-19. I mean, how do you get around it as a parent?
Yes, and I think the anxiety and fear is obviously natural. Parents always want to look after the well-being of their children, and so these facilities which we've now implemented, these overflow facilities, are going to be very strict in the implementation of all protocols as it relates to COVID-19. Social distancing will be non-negotiable. Hand sanitizing, hand washing at these facilities will be non-negotiable. Also, the way our nurses care for the parents will also make use of social distancing practices. When I visited one of the facilities, apologies. When I visited one of these facilities in Elsie's River earlier last week, there was a lot of excitement because the nurses were clear in how they would deliver the services, implementing social distance. And so it's a partnership here. We cannot do it on our own. And so we're appealing to residents to work with us so that we can help to look after them. But it goes back to the principles of the golden rules that we share in the Western Cape and in the city of Cape Town, that our individual health is our responsibility, and to look after other members of our communities, we have to look after ourselves as well. And so we're holding hands with our residents to make sure that we can get our immunization numbers back, get our TB numbers back up, and our HIV care numbers back up. And so we've started that process, and I'm hoping that as we measure this and monitor this, we'll start to see an increase in the number of people coming back to our clinics over the next few weeks.
You mentioned measles. That's one of the inoculations that worry you. If it is missed, parents, again, will want to know whether or not missing that would be a big one for the kids. And you've suggested in your earlier answer that's one of those inoculations that you advise parents not to miss.
Yes, absolutely. There's 14 of them through an 18-month period. Measles, diphtheria, the BCG vaccine in the very early stages are all important here. And the important fact to remember is that in some cases, like the measles vaccine, it's not a once-off vaccination. You've got to come back for a second one. And so too with a number of other vaccinations. Some could go up to 3 doses being required before the vaccination is completed. And so we're wanting to let our residents know that this is not a once-off. If you come to our clinics, we will be able to start you on the Medicaid, on the immunizations for the children specifically, catch up if needs be, and then to continue care. And so this overflow facilities, which the city has invested 70 million rand in, is really, I think, going to be a game changer for us, because where our existing clinics are, we're able to decant that significantly in terms of the numbers of patients accessing that services. And because we've gone to our community centers, we're also able to ensure that patients are safe from the weather, because we've recently had very strong rains in the city. And so we are going to make sure then that we don't unnecessarily expose them to other conditions because of the amount of work being put into the space at the moment to continue the care in terms of the continuum of care that we are needing to make sure is focused on at this moment.
All right, we're going to leave it there. Zahid Badroodien is the Mayoral Committee member for Community Services in Cape Town. Thanks very much indeed for talking to us.